We are all pretty familiar with acetaminophen, especially for me this morning. A common drug contained in common pain relievers. Well, the FDA has come out with some new warnings, and the doctor is in today advising us about the dangers of accidental overdose. Dr. Ackerman is joining us, one of the First Coast's leading oncologists. He joins us every Friday, of course. And Dr. Ackerman, this is one of the things that even we were talking to Dustin Cross a second ago, is coming up later in the show, and he's like, I can overdose on acetaminophen? Yeah, and the FDA is coming out saying you absolutely can, and they have some warnings.
Yeah, thank you, Casey. People don't realize it, but you can overdose with acetaminophen. Now, it's normally found in Tylenol. We know Tylenol has acetaminophen, but there's other brands besides Tylenol that have acetaminophen. There's Panadol, which you might see. Here's a generic of acetaminophen that we picked up at one of the...
Yeah, because they usually have the store brands and then they have the generic brand.
A little bit cheaper,
yeah.
But they both have acetaminophen in it. And so recently, there's been increasing concerns about the damage with excessive doses of acetaminophen. And we always thought it's a safe drug, but it is safe in normal doses. But in excessive doses, it could cause liver damage. And many people take it excessively accidentally. They aren't just popping tons of Tylenol.
Sure.
They take it accidentally. So the FDA has recently released new recommendations, mainly for physicians now, but ultimately it'll also be on physicians for prescription drugs, but ultimately it'll be on other drugs as well. But what the FDA has urged us physicians to do is to minimize or stop, preferably, prescribing these certain combination drugs that have a lot of acetaminophen in them. So, you know, for certain pain, we give patients drugs called Tylox or Percocet or Vicodin. These drugs have codeine in them as well as some Tylenol in them. And historically, you'd be able to get them with doses of Tylenol of up to 500 milligrams, which is like an extra strength Tylenol. So now the FDA has asked us to only prescribe these combination drugs with 325 milligrams of Tylenol in them. So Tylox or Percocet, which has codeine and Tylenol, will have a lower dose of Tylenol in them. So the FDA asked the companies back in 2011 to stop manufacturing these combination drugs with high doses of Tylenol in them. And over many of them, almost all of them, have complied thus far.
Is this just over the counter, or this prescription? This warning applies to acetaminophen across the board?
Well, the warning applies across the board, but right now the FDA is focusing on prescription drugs, and they're going to address the concerns of over-the-counter drugs later this year. But some drug companies, Tylenol, because they're the biggest acetaminophen, they've taken a proactive approach. So if you see here on Tylenol, it has some new labeling on it that says, do not use with other products that contain acetaminophen. And this is mainly on those that are extra strength. So this bottle of Tylenol here is extra strength, has 500 milligrams in it, as opposed to the normal strength Tylenol, which is 325 milligrams.
Okay, and the thing of it is like you don't even realize sometimes with like Dayquil, NyQuil, whatever, that one of the ingredients in it is acetaminophen. And so if you're taking this and then you think, oh, I need to take some acetaminophen or Tylenol on top of that, then that's how you could potentially overdose. But what does it mean to overdose on acetaminophen? I mean, how can someone do that? I mean, how can that affect your health adversely?
Well, it's a lot easier than you think. We recommend that adults take no more than 4,000 milligrams or 4 grams of acetaminophen per day. And so if you don't read the directions and you're ignoring the dosage of the acetaminophen in the medications, you can easily get to that amount.
Okay.
So a lot of patients take Tylenol and then they'll take a Sudafed also. And what they don't realize is the Sudafed also has acetaminophen in it, and this is the same amount as a regular Tylenol. So if you take 2 extra Tylenol and two Sudafed,
because you think you're targeting the nose and the pressure here, and you think you're doing the headache with this one, but you're...
Right, you're already up to 1,200 milligrams. And so just doing that three or four times a day, you're over the amount that you should be. So be careful. There's a lot. You could have this inadvertent overdose, and if you inadvertently overdose, and I've seen patients in my own practice that they've probably been on combination drugs, and then they get a cold, they take some of the cough medicines that have Tylenol in it, and they start getting liver damage, and we could see in their blood work that their liver enzymes are elevated.
And what are some of the symptoms? I mean, what should we be on the look for to try to recognize that we might have liver damage from inadvertently taking too much acetaminophen?
So when you're seeing a physician, often like my patients are seeing me, because if I'm actively treating them, I'll do blood work and I'll see if their liver enzymes are elevated. And that may be an early sign that they could be taking too much Tylenol, that sort of thing. But if you're not getting your blood done and you take too much of it, you will start having real signs and symptoms. Specifically, you'll have dark urine. Specifically, you'll have persistent nausea and vomiting. You may have some abdominal pain and abdominal distress. You may become extremely tired. And if it's pretty advanced, you can get jaundiced skin, which is yellow skin and yellow eyes.
So what do you recommend then? I mean, reading the labels, what do people who are watching right now need to do to make sure that they do not put themselves in harm's way by overdosing on this?
Okay, so when you're taking these sort of medications, number one, read the labels of the medications that you take in a given day, so you can see how much acetaminophen you're taking in that day. Number two, don't take more than 4,000 milligrams or 4 grams in a single day. And also, finally, avoid alcohol with acetaminophen because the two can act synergistically and increase the risk for liver damage.
All right, well, it's a good warning. It's important to be, we always talk about empower yourself with knowledge, and knowing that you're potentially at risk for overdosing on this stuff inadvertently is just the first step. So thank you so much.
Thank you, Casey.
Dr. Ackerman, for being here. We appreciate you as always and coming in every Friday and sponsoring this segment. If you have questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.